our next session lined up. We have Sonali here with us. And I can't even count the number of times we have had sessions with Sonali. And her sessions are so loved. She is one of the most loved experts on the panel with us, wherein, we keep calling her back because we can't have enough of her. She's a IBCLC certified lactation consultant. She's founder of Birth Basics. And she conducts birth workshops for a lot of expecting parents. I think she must have trained thousands and thousands of parents till now. We see her active on her Instagram channel, and people love her for her content, for the work that she does. And one thing which I personally enjoy when she speaks, it feels so calm to listen to her. She has this very calm, vibrant energy to her. So heading it over to Sonali. Sonali, please take it up from here.
Thank you so much, Shalu, and thank you, the entire SuperBottom team for showing so much love, and, the entire community. I think you're doing such a fabulous job with getting everybody together here on this platform. So it's always a pleasure to be a part of this. Today, I'm talking about having a mindful labor. And I'm going to start with talking to everybody over here and asking you what you feel about the whole laboring process. So I always try to involve the audience in my communication. It really helps me understand what your questions are. So I'm going to let you direct the conversation here. So the first question I'm going to ask is, what is the first thing that comes to mind when you think about labor? Okay, anybody here who wants to write out, is it, okay, painful, scary, uncomfortable, more pain, terror? So I can see a lot of people are really worried about pain, the smell of the hospital, lots of contractions. Wow. Okay. So I can see that there's a lot of fear around the laboring process. And that's why I decided to talk about having a mindful pregnancy, because it's very important for you to get a sense of what this fear of labor is going to do to the laboring process and how it's going to impact the way you experience your labor. So, the thing is that fear creates a physical response in your body. When you start becoming tense, when you start thinking of the laboring process, it's usually because it's so unpredictable that we are so fearful of this journey. We don't know how labor is going to start. If it's your first baby, you don't know what a contraction feels like, right? You don't know when to go to the hospital, or there are so many questions about, will I be able to cope? I mean, I know that my friend coped with labor well, but what about me? Or you might have heard of birth stories where labor started in one way and then it progressed, to end up in a C-section. So there is so much of unpredictability around labor. I think that's one of the first sources of fear, this whole fear that everyone's talking about. And how do we eliminate it? What impact is this fear going to have in the birthing room, in the way you experience labor? So before we start about talking about fears and how to eliminate it, I want to take a moment and ask everyone to affirm to themselves. See, pregnancy is a physiological process. Labor is a physiological process. It's actually designed to work. But unfortunately, because of so much in the media about, how painful it is and all the pictures we see about labor and birth, we create this mental picture of extreme pain and extreme terror. Okay. But it's very important to understand that when everything is aligned well, labor is actually not even such a painful process. You're going to have some amount of discomfort, because only then you're going to know that you're even in labor. Otherwise, your body is not even going to realize the baby needs to come. So to remind you that you're in labor, your body will send some signals of pain, but they are manageable. It's pain that you can really cope with. And the biggest thing that can help you keep labor discomfort manageable is eliminating the fear around the whole process. So the first thing I want everyone to affirm over here, because affirmations are extremely powerful, positive thoughts are extremely powerful. I want you to affirm that my body is perfectly designed to give birth to my baby. if you can write it in that inbox, if you can write it in the chat box, that would be wonderful, because it will solidify that affirmation for you. I want you to affirm that my body, that is your body, is perfectly designed to give birth to my baby. So once you start repeating these affirmations to yourself, initially when you start saying an affirmation out loud, when you look at yourself in the mirror and say it, it almost seems as if it is not authentic. It seems as if, no, it's not possible. I've heard labor is so painful. How is this going to be so easy for me? But that is the trick. When you start affirming, when you start throwing out that positive energy into the world, the universe will give that back to you. And how is it going to give that back to you? Because it will literally rewire your brain to reach out for the right information. It will remind you every day to practice the breathing techniques that you learned in your Lamaze class. It's not only getting all this information, it's actually practicing it. We've forgotten that, haven't we? So everyone logs into the internet, you look up Google searches on how do I cope, you go for all these seminars. But the bottom line is you need to go for 1 or 2 classes, read 1 or 2 articles, spend rest of that time practicing with your partner. Okay, so unless you practice with your partner, unless you affirm to yourself that your body is capable of doing this, it's going to be a harder journey. That's all. Okay, so how do you eliminate this fear, and what impact does fear have on your body in labor? Now, let's give you an example. Okay, if I tell you I'm going to take my very long nails, which I don't have long nails. Because I'm a lactation consultant, I need to cut them really short. But if I tell you I'm going to take my long nails and pull them down on blackboard, what kind of an emotion does it create in your body? Can you type it out for me so I know what you're thinking? I don't like the feeling of nails on a blackboard, but can anybody? Okay, discomfort, irritating. Yeah, so you'll feel that there's this irritating noise. It literally will reach your teeth, right? For some of you, you'll feel like your teeth are getting sensitive, the screeching feeling. And all of us are already experiencing that negative emotion attached to it. Even though I'm not pulling my nails down a blackboard, I can already feel my teeth responding to that, right? Now, if I tell you to take a really, really sour lemon, very sour lemon, and on an empty stomach, bite into this lemon with your teeth and let the juice of the lemon run into your mouth. What happens? What happens? More irritating? Oof, no. Neha says no. Sore mouth, khatta, yuck. Nausea, yeah. Does anybody feel like the thought of sucking on a lemon actually is creating saliva in your mouth? Like you might feel like your salivary glands are tugging. You'll feel like your mouth is actually watering. For some people, it's because they love lemon. I mean, I can see some people are saying, love it, love it. But yeah, for some people, it's also because they don't like the lemon. And what is happening is lemon is acidic. You're sinking your teeth into this lemon. Your body is recognizing that this acid is going to come in, and it's already secreting saliva in your mouth to counteract the acidity. Okay, so think about that. Think about how powerful the body is, how powerful the mind-body connection is. There is no lemon. Okay, you haven't put it in your mouth, you haven't sunk your teeth in it, but your mouth is already secreting saliva. So this is the effect that fear has on the birthing process. If you put it in perspective, if you're constantly stressed, if you're thinking as you get closer to your due date, if you're thinking what is going to happen to me, will I be able to cope with it? You ask everybody around you, how did your labor go? Can you tell me? And then they have this story of theirs, which may not be the best story that you should be listening to right now. You get so scared and that fear builds upon. And then some people even decide to have a C-section because they don't want to bother with it. They say, let's just get the baby out. Okay. But the truth of the matter is, the more fear you carry into the birthing room, the more stress hormone your body is going to release. Even though nothing has happened, you haven't even started your first contraction, you don't even know how labor is going to be for you. Maybe labor won't be bad for you at all. Okay, it really depends. For some people, it's a very easy process, and for some people, it may be difficult, but because of very, very specific issues, which are actually in your control to some extent. Okay, so if you go into the birthing room carrying all these fears, then your body will set up what we call the fear, tension, pain cycle. The fear, tension, pain cycle. So fear is going to cause you to contract all the muscles in your shoulder. When you contract all the muscles in your shoulder, your hips, your jaw, you tend to get so tight that your body is going to start sending the blood and the oxygen to these muscles of defense. You need these muscles to fight. You need these muscles to run away from a problem. Okay. But in labor, you really don't need these muscles right now, right? The only muscle you need is your uterus. You need it to contract. You need it to give birth to your baby. So if you're going to take all this blood away from your uterus and your baby and give it to your jaw, give it to your shoulder, give it to your hip, then what is going to happen? You're going to have less oxygen coming to a muscle that's working hard. And this is going to create pain. So this is what we call the fear, tension, pain cycle. And we really want to break this cycle. How do you break the cycle? The first thing you need to do is arm yourself with knowledge. Honestly, I want you to type this in the inbox again. My body already knows how to give birth to my baby. Okay? My body already knows how to give birth to my baby because this is such a physiological process. But when you go to a birthing class, when you read up articles about natural birth, about what your body needs to do in labor and birth, you're basically teaching your body to trust what it already knows. In labor, your body is going to tell you to slow down your breath. It's going to tell you to get up, walk, and move. It's going to tell you to get onto your hands and knees and move your hips. But you will have a lot of fear. You'll be like, can I do all these things? Can I walk? Everybody at home may tell you, listen, you're in labor, lie down. But no, you want to walk, you want to move. You should be able to trust what your body is telling you and actually do these things. So when you go to a birthing class and you practice all of these things with your partner, it creates a kinesthetic sense. Your body understands how to do this. And when you're in labor, you will be able to do all of these things, what your body is telling you to do already, and experience a birthing journey, which is really not very painful, easy to cope with, and much, much more manageable. So everybody comes to a Lamaze class to learn the breathing techniques to manage and cope with labor pain. It is a combination of techniques that help to cope with labor pain. You need to know how to breathe. You need to know what position you should keep your body in, how to sway your body when your baby is coming out, what your partner can do to support you. Maybe he can massage your back, or maybe he can give you like a light touch massage. He can play music for you. He can give you a heating pad. He can give you some water. A combination of all of these things will keep your mind really, really calm, because it's going to release oxytocin in your body. When you feel loved and supported and protected, your body releases oxytocin. It's the love hormone. It's the hormone that makes you fall in love with your partner, makes you fall in love with your baby, and then it's also released when you're breastfeeding. So in labor, it's going to help the laboring process speed up. It's going to make sure that you don't feel too much discomfort. And all of this will be released in your body with the right kind of support, without any fear lurking in the background in the back of your head. Okay? Excellent. I know that my time is almost up, so I want to really talk about one thing, that is one more thing in addition to fear that can contribute to labor discomfort and pain is the position of the baby in the womb. Your baby needs to be head down. The baby's head needs to be engaged in the pelvis, but also your baby needs to be facing in towards the spine in this direction. when your baby is facing in towards the spine, there is a lot less pain when you give birth. Okay? So you need to do your yoga exercises to bring your baby into a good position for birth. Make sure you're doing a lot of hip opening exercises. Practice your breathing techniques. Make sure what happens when you breathe? You're bringing in so much oxygen. All that oxygen is going to go to your baby, to your uterus. It's going to help calm you down. Learn to keep your jaw and your facial muscles relaxed so that the only muscle that's working in your body is your uterus trying to give birth to your baby. Okay, so with that, I am going to sign off. If you have any questions, when can we start these exercises? You can start these exercises at any point, earlier the better. Start in your first trimester as soon as your doctor gives you the green signal to exercise. Exercises to position the baby, you should definitely start by 30 weeks. By 32 weeks, baby should be head down. By about 36, it's a range, 32 to 38 weeks. By 36, 37 weeks, you should start doing a lot of deep squats to push the baby's head into the pelvis. And then a lot of cat and cow, hand and knee position to make sure the baby is facing in the right direction so that you don't have too much back pain in labor. Okay, so any other questions? All right, thank you so much. I'm going to leave you with one last affirmation. You know, I want you to say that I absolutely believe in myself. I believe in my ability to give birth, and I believe in my partner's ability to support me. So I really, truly believe that dads are the rock stars in the birthing room. So hopefully you and your partner have prepared yourself adequately. We do have a childbirth education class. The next one's coming up on June 17th. So if you guys are on my Instagram page, would love to have you drop by, say hello over there. Any questions you have, you can ask at any time. Love all of you. Hope you have a wonderful, wonderful birth process, and here for you anytime. Thank you so much, guys.
Thank you so much, Sonali. We'll be sharing Sonali's Instagram handle with all of you, and you can join her upcoming sessions. And if you have any one-on-one doubts, you can get those cleared by her. Thank you, Sonali. It was once again great having you here. It's always great to have you with us. Thank you so much for joining us.
Thank you so much. Bye, Shalu.
Bye.